see in the clinic that we would usually see post-operatively is a tibial plateau injury. The tibial plateau is basically the top of the tibia. So this is the knee joint, front and back. Top of the tibia in this area here, and this is the tibial plateau here. So usually quite a high force, high velocity injury. Someone jumping out of a window or coming off of a motorbike, where basically there's a high force coming in this sort of position or from the bottom. The femur gets pushed into the tibia at high velocity, and usually it fractures the top of the tibia. Okay. Orthopedics use a classification which is called a Schatzker classification, and Schatzker 6 is a much more serious injury than, for example, a Schatzker 1. It may be managed conservatively with a splint, or you may end up having surgery to fix these pieces in here. Okay. Usually people will come through to physiotherapy post-surgery. They may have weight-bearing restrictions. They may not be allowed to put the leg down for 6 weeks, 8 weeks, 12 weeks, depending on the severity. They'll have reduction in range of movement. They'll have strength deficits. They'll have stiffness of the joint, and they may have weight-bearing restrictions. So it's all about trying to progress those things on. Most people do very well post-operatively. Get you doing some exercises, stretches, soft tissue work, loosen the joint up, try and get that range of movement back. It's all about trying to achieve full range of movement of the knee, full weight bearing, and then people can return to normal activity. And most people do very well. It depends on the severity of the injury, the eventual outcome, but most people do very well. But it's a lengthy rehab sort of process, so it does take some considerable time, but generally we get a really good outcome.